Good morning. My name is Lindsay Thompson, and I'm the Director of Public Affairs for the Canadian Counselling and Psychotherapy Association. I'm also a member of the Canadian Alliance of Mental Illness and Mental Health. First, I want to acknowledge that we are located on the unceded territory of the Anishinaabe peoples. Tout d'abord, j'aimerais souligner que nous sommes réunis sur le territoire des peuples Anishinaabe. We are here today representing the Canadian Alliance of Mental Illness and Mental Health, also known as CAMIMH, and with me here today are fellow members, Co-Chair Dr. Kim Hollihan and Chair of the Public Affairs Committee, Glenn Brimacombe. Nous sommes ici pour parler du bulletin de rendement des provinces et territoires au sujet de la prestation des services de santé mentale accessibles aux Canadiennes et Canadiens. Et malheureusement, chacun d'entre eux a reçu une note d'échec. Pour décortiquer tout cela, je passe le micro à ma collègue, Dr. Kim Hollihan.
Good morning. CAMIMH is an alliance of 16 national mental health and substance use health organizations comprised of people with lived and living experience, their families and caregivers, and mental health care providers. CAMIMH's mandate is to ensure that mental health is firmly placed on the national agenda so that the people of Canada with mental health problems and their families receive timely access to accessible and inclusive mental health care programs, services, and supports. Knowing that the COVID-19 global pandemic has had a significant impact on our collective mental health, CAMIMH surveyed Canadian residents who have accessed mental health services in the past year and found that the provinces received a collective grade of D in providing access to mental health professionals. To be clear, 6 provinces received a grade of D and 3 provinces received a grade of F. These are near-failing grades that clearly need to be improved upon. Our survey shows that Canadians are not getting the care they need when they need it, and that must change. Today, we are calling on all levels of government to significantly increase their investments in providing better access to mental health services in the provinces and territories across Canada. Lindsay.
Now, more than ever, we need improved access to accessible and inclusive mental health care programs, services, and support. There can be no mental health within the context of health. It is deeply concerning to know that close to half of all survey respondents gave the provinces a failing grade of F. Additionally, the survey showed that only 23% think that mental health supports are meeting their need, and a large majority of respondents, 9 out of 10, feel that both the federal and provincial governments need to increase the availability of mental health care providers to ensure timely access to care. The survey shows overwhelmingly that Canadians do not have timely access to the mental health care services that they need and deserve. Glenn.
Good morning. As we begin to emerge from the COVID-19 global pandemic, it is clear that the people of Canada can and must benefit from greater partnership and collaboration between the federal government and the provinces and the territories. After all, just like there is only one taxpayer, there is only one client who needs to see much better results when it comes to accessing mental health care programs, services, and supports. 6 Ds and 3 Fs simply won't cut it. The time is now to see accelerated investments in mental health and substance use health. While the recent 10-year agreement by the federal government is movement in the right direction, it did not provide protected funding through a Canada Mental Health Transfer valued at $4.5 billion over 5 years, which is a significant disappointment. Moving forward, as the federal government negotiates individual bilateral agreements with the provinces and territories worth $25 billion over the next 10 years, CAMIMH and Canadians will want to know what are their priorities, how much will be invested over what time frame, and what impact it will have on the ground in terms of improving access to mental health and substance use health programs and services. For example, in our survey, 91% of respondents said they should not wait more than 1 month for treatment. They also strongly supported the setting of evidence-based benchmarks for wait times. Again, we can and must do much, much better.
We are highlighting today systemic issues with healthcare in Canada that are within the control of governments to fix. We would like to recognize and express our extreme gratitude for the tremendous contributions of mental health and substance use healthcare providers in face of the challenges of the pandemic. 2/3 of survey respondents said once they were able to access mental health supports, these supports met all or most of their needs. And those who felt their needs were not met or only partially met cited wait lists, a systemic issue, as the reason. An overwhelming majority felt that governments need to increase the availability of service providers. CAMIMH looks forward to working with all levels of government and others to improve timely access to publicly funded mental health and substance use health care programs, services, and supports. Our mental health matters, and there can be no health without mental health. Thank you, and we welcome any questions that you may have.
All right, just a reminder for the participants on Zoom, if you have a question, please use the raised hand function. Juste un petit rappel pour les participants sur Zoom, si vous avez une question, s'il vous plaît, utilisez la fonction main levée. We have no questions on Zoom. Thank you very much.
Thank you.
Merci.
Thank you.